Okay, so like I mentioned for today's training, this is recognizing abnormal observations. And this is brought to you by San Ysidro Health, San Diego PACE. And so for today's agenda, we'll go over understanding the reason why documenting is important and what observations should be recognized, particularly any abnormal changes. We'll also look at what cues to look for between physical and non-physical changes. And this is just to better care for the persons we're responsible to look after. And of course, we'll go over a brief summary with all the key points we covered in today's training. There's a question on the slide and it reads, as we age, some changes are inevitable. Can you think of some age-related changes we can expect? Okay, well, I'll go ahead and I'll share my thoughts. Exactly, yes, forgetfulness is one thing that we will experience as time goes by and we age. Aging does affect our cognitive thinking. And I'll go ahead, thank you for your participation, Jawan. I'll go ahead and I'll share my thoughts on the inevitable. For me, I think our skin goes through many changes as we age. We may develop wrinkles sooner or later, depending on the sun damage that we allowed our skin to receive. Also, discoloration may happen and it's caused by some health factors that we may get later in life. Also, thinness of our skin. As we start to get older, our veins tend to show or see through a little bit more through our skin. And our skin, because it is the most visible to others, depending on how we take care of it, it can start to give away our age pretty soon. And to kind of get a little head start on that, you probably know by now that drinking lots of water and fluids will keep your skin hydrated and your skin looking wonderful if you take care of it. Alrighty, so we'll go on to our next slide here. An aging nation. So this illustrates that for the first time in the United States history, older adults are projected to outnumber children by 2034. And this is thanks to science and medical advancements. Healthcare has helped extend the longevity for many, particularly for those in the older age group, 65 and older. Also, older adults are now living longer, healthier lives and thriving compared to like 20 years ago. A lot of older adults are now more proactive with healthy eating, exercising, and keeping regular medical routines. Checkups that helps kind of progress aging a little bit if you tend to, like I mentioned, take care of yourself. And so we're going to go on now to see this chart. You can see clearly that in 2016, there was a significant gap uh, with the children clearly outnumbering the older population. So back then, the children, those under 18, their population outnumbered the older group. And by 2034, that kind of levels out a little bit for both groups. You can see it's just a little of a difference there. The older group is kind of catching up. And then in 2060, it's clear older adults will outnumber now for the first time in history the younger population. And like I said, that has to do with better medical advancements and the way people are, getting educated about their health and being proactive. As we can see here, this illustrates that 92% of older adults have at least one chronic condition, and 77% have at least two or more conditions, all at the same time. Just a moment, I forgot to turn off my phones. Additionally, there are 4 chronic conditions which cause almost 2/3 of all deaths in people 65 and older each year. And those 4 groups are those four chronic conditions are heart disease, cancer, stroke, and diabetes. Whether an aging adult has one or more diseases, the matter is this. All it takes is just one chronic condition to be the leading cause of death among older adults if that condition is not properly managed. And now we'll go on to this slide here. Oh, I'm sorry, and I forgot to mention, going back to this slide, um, the chronic diseases that are labeled here, the four chronic conditions, as mentioned, these primarily affect the older the older minority group in their population. It also affects individuals with obesity, and people living in low-income communities are at much higher risk of developing these four main chronic diseases. Sorry, I forgot to mention that part. And why is recognizing and documenting changes important? We can see here mild symptoms and behaviors can be clues to underlying illnesses such as dehydration, pneumonia, diabetes, depression, Alzheimer's, and sleep apnea. For example, when a person develops diabetes, there are just subtle clues at the beginning that come on gradually, right? The person at first may not think too much on it until that individual actually um, suddenly starts to have excessive thirst, followed by frequent urination, or they might have long-lasting fatigue, and the list goes on. These are all changes that need to be documented, right? Now getting into the physical changes. The body experiences many physical changes as people age. An individual with health-related chronic conditions may experience a decline in their health, as I said earlier, if that condition is not properly managed. When changes do occur, some patients may or may not be able to communicate these changes to us because they may have limitations. Therefore, we need to be able to recognize any changes when we're taking observations of our loved ones or our patients. The reason it's important to keep daily observations is to look for any slight changes to a person's daily pattern. And don't forget to always recognize the change, identify it, document it, and intervene. Okay, now we're going to get into this slide. We all know that as a person's health condition declines, the first thing that is affected is their ability to walk in most cases, right? Normal walking changes. It changes because there's slower walking speeds, there's reduced step lengths, and what to watch for. Um, Sometimes, a loved one or a patient may have difficulty getting in and out of bed as not their usual pattern or routine. They may also have stiffness with sitting for long periods of times, and then they attempt to stand up and it may take them a few minutes to kind of get started up again. Also changes in balance. They may get dizzy, shifts in equilibrium, unsteadiness, or perhaps they're favoring one side more than the other just to avoid pain or aches. These are changes that take place with changes in our health. Here, with weakness levels, muscles generally lose some strength and flexibility. Causes for concern may be the inability to ambulate or walk, functional decline, anything that is a gradual decrease in physical and cognitive functioning that can make it difficult to perform the basic activities of daily living, the ADLs. And this may also affect us by increasing the risk of a fall. That's very important to make sure that a person 65 and over avoids falls because those can be very fatal and life-threatening. And also, if the individual shows extreme weakness, speak to their care provider and request a geriatric assessment. Requesting this assessment is helpful because this type of assessment involves a multi-dimensional and multidisciplinary team to evaluate their functional ability, their physical health, their cognitive and mental health, and their socio-environmental circumstances. All that makes a difference. And remember, a geriatric assessment differs from a regular medical appointment. You actually need to request this. So for elimination, normal elimination changes include the inability to hold the bladder for long periods of time. Constipation can also be more common due to slower metabolisms. Well, normal elimination pattern for the elderly can vary from person to person. For instance, an individual with a condition such as cancer who may be receiving chemotherapy may or may not all experience the same incident with constipation. It all depends on the person, right? Other possible concerns also include urinary incontinence, uh, inability to empty the bladder, again, urinary retention, painful urination, blood in the urine, blood in the stool, or diarrhea followed by weight loss or fever. These are all things we're to document by identifying the condition when it begins and as it worsens, and be proactive in treating the pain symptoms for comfort. So now for vital signs. Vital signs and normal ranges also vary by age, weight, sex, and overall one's health. As we age, our vital signs may change depending on how healthy we are and the medical problems we may have. Pay close attention to changes such as fever with no known illness, anything over 100, breathing, if breathing changes, if heart rate changes, if there's dizziness involved, if there's both low or high blood pressure. Low blood pressure would be 90 over 60, anything below that, and high blood pressure, anything over 130 over 80, and unexplained weight loss. Again, what do we document? Okay, we identify when a person's vitals or condition changes. We treat their symptoms. We report this to the supervisor and perhaps call 911 if needed, if the patient or the loved one is in distress. And also know your ABCs. Your ABCs, that's the for A for airway, B for breathing, C for circulation problems, especially if they present any abnormal signs. Remember those when you're documenting. Now we're going to get back to this slide that is on skin. Skin changes with aging can include thinning, wrinkling, and dryness. Beware of skin that appears puffy, shows redness, breakdown, sores, and or rashes. For documenting changes on the skin, again, document anything abnormal that's abnormal color, blue, purplish, black. Um, Document and report any poor circulation, which can cause the skin to be pale, white, ashy, waxy in appearance. Now for physical changes, we're going to go over these changes in the next slides. Older adults can experience a variety of non-physical changes, including cognitive, mental health, and sensory changes. So these would be demeanor, socializing less talkative and withdrawn, appetite, not interested in eating or hardly eating at all, sleeping, falling asleep in unusual places, or sleeping more or less than usual. Speech, slurred, volume changes, unable to find the correct words. Confusion or agitation, talking more than usual. Complaints of pain, wincing, making faces or grimacing, um, giving an indicator that they're not feeling well or they're having some type of pain. Sorry. Okay. So let's think about difficulty with everyday tasks. Perhaps if your loved one is having trouble with the remote control or following recipes, obviously they are experiencing a cognitive setback. They might be repeating the same story, repetition, asking the same questions. Communication, they may have trouble joining or following a conversation, stopping mid-thought, deferring to family or caregiver to answer questions. Memory changes, difficulty remembering details or misplacing their keys, getting lost, wandering. This is a big one, especially for older adults who are starting to have like the first symptoms of dementia or Alzheimer's, wandering off, getting lost. Personality changes, withdrawing from people, activities that they once enjoyed. They might be highly irritable, depressed, or show signs of anxiety. Orientation, losing track of the day, the time, or the place, or the year. Judgmental changes, again, poor cognitive, they're having poor financial decisions, neglecting their hygiene. And our final conclusion, recognizing abnormal changes can help identify underlying illness. So we covered, why it's important to recognize abnormal changes, because it can help us identify underlying conditions, right? And as we age, we can expect inevitable changes to our body and our mind and our physical health. And in the near future, we just learned that older adults will outnumber the youth because the older population is more proactive than ever before. And the result is they're living longer, healthier lives. Also, older adults over 65 have at least one or more chronic disease caused by the four chronic diseases, which are heart disease, cancer, stroke, and diabetes. And there are physical and non-physical changes that take place, and we must recognize, identify, and document. So this has been the end of our training, and I want to take the time to thank you for joining us. And we have many upcoming trainings coming in the next weeks. So we would be glad to see you join and participate. And with that being said, have a good the rest of your day, and thank you very much. Does anybody have any questions that you may want me to answer? If not, then have the rest nice, wonderful day.